If you are over 60 and you walk every day thinking you are doing your body a favor, I need you to stop everything right now and watch this video to the very end. Because what I am about to share with you today is something most doctors never talk about in their offices. Something that is quietly and consistently damaging the health of millions of seniors around the world. I am Dr. Rose, cardiac surgeon with over 20 years of clinical experience treating heart disease, joint complications, and age-related health decline. And today I am exposing 6 walking mistakes that are silently destroying your health after 60. I promise you, by the time this video is over, you will never walk the same way again. And that is a good thing. Stay with me until mistake number 6, because that one is the most dangerous and the most overlooked. Now, before we dive in, I want to ask you something. When was the last time your doctor sat down with you and explained exactly how to walk? Not just told you to walk more, but actually broke down the right technique, the right surface, the right timing, the right footwear. For most of you, the answer is never. And that is not your fault. The medical system is busy, appointments are short, and walking seems so simple that nobody thinks it needs a tutorial. But here is the truth. Walking after 60 is not the same as walking at 30. Your body has changed. Your joints have changed. Your cardiovascular system has changed. Your muscles recover more slowly. Your balance is different. And the way you walk needs to reflect all of those changes. The good news is, once you know these 6 mistakes, they are easy to fix. Small adjustments that can make a massive difference in your energy, your joint health, your heart function, and your overall quality of life. Let us get into it right now. Mistake number 1, and this is so common it genuinely concerns me every time I see it, jumping straight into walking without any warm-up whatsoever. You wake up in the morning, put on your shoes, step outside and start walking. Or you finish lunch, stand up, and immediately head out for your afternoon walk. No preparation, no transition, just cold muscles meeting full movement. And here is why that is a serious problem after 60. When your body is at rest, your muscles, tendons, and ligaments are in a contracted, stiff state. Blood flow to those tissues is reduced. Your joints have not yet produced the synovial fluid they need to move smoothly. Now at 25, your body can handle that shock. It adapts quickly. But after 60, your recovery systems are slower. Your tendons are less elastic. Your cartilage is thinner. And your heart needs more time to shift from resting mode to active mode. When you skip the warm-up and jump straight into walking, you are forcing your cardiovascular system to spike suddenly. Blood pressure rises sharply. Your heart rate jumps without a gradual transition. For someone with undiagnosed or managed heart disease, and many seniors have it without knowing, that sudden spike can be genuinely dangerous. The fix is simple. Before your walk, spend 5 to 7 minutes doing gentle warm-up movements. Slow marching in place. Ankle circles, knee lifts, hip rotations, gentle calf raises. These simple movements warm up the muscles, lubricate the joints, and give your heart a smooth, safe transition into activity. Never skip this step. It takes less than 10 minutes and it protects everything. Mistake number 2, and this one is responsible for more joint damage in seniors than most people realize: wearing the wrong shoes for walking. Now, when I say wrong shoes, I am not just talking about high heels or dress shoes. I am talking about flat canvas sneakers, worn-out trainers with collapsed soles, rubber slippers, or even barefoot walking on hard floors. Here is what happens to your feet as you age. The natural fat padding on the soles of your feet, the cushioning that protects your bones and joints from impact, gradually thins out after 50. By 60 and beyond, many people have lost a significant portion of that natural shock absorption. That means every single step you take sends impact energy traveling directly up through your heel, into your ankle, your knee, your hip, and your lower spine. Over weeks and months of daily walking and unsupportive footwear, that repeated impact accumulates. It inflames the knee joints. It wears down cartilage. It strains the lower back. It can even cause or worsen conditions like plantar fasciitis, a painful inflammation of the tissue along the bottom of your foot that makes every morning step feel like walking on glass. What you need are proper walking shoes with 4 key features. First, cushioned midsoles that absorb impact. Second, arch support that distributes your weight evenly across the foot. Third, a firm, stable heel counter that prevents your ankle from rolling. And fourth, A wide enough toe box that allows your toes to spread naturally as you push off. Invest in a good pair of walking shoes. Visit a proper shoe store, have your feet measured, and replace your shoes every 6 to 8 months or every 300 to 500 miles of walking. This single investment could eliminate chronic knee pain, back pain, and hip discomfort that many seniors have simply accepted as a normal part of aging. It is not normal. It is preventable. Mistake number 3, walking exclusively on hard, unforgiving surfaces like concrete pavements, tiled floors, or asphalt roads. This is one of the most overlooked sources of joint damage in seniors, and it is one that most people never think to question because walking on the pavement seems so ordinary. But let me put this in perspective for you. Concrete is one of the hardest materials on Earth. It has virtually zero shock absorption. When your foot strikes concrete with every step, 100% of that impact is transferred back into your body. Compare that to grass, which absorbs a significant portion of that energy. Or a rubberized running track, which is specifically engineered to reduce joint impact. Or even a well-cushioned treadmill, which has built-in flex and give. Now multiply that concrete impact by 2,000 steps. That is roughly 1 mile of walking. Most seniors walk 2 to 4 miles daily. That is 4,000 to 8,000 high-impact strikes against hard concrete every single day after day, week after week, month after month. Over time, this relentless pounding accelerates cartilage wear in the knees and hips, triggers chronic inflammation, and contributes to the development or worsening of osteoarthritis. It also increases stress fracture risk in the feet and ankles, particularly in seniors with lower bone density. The solution is to vary your walking surfaces intentionally. Walk on grass in the park whenever possible. Find a rubberized track at a local school or sports facility. Use a cushioned treadmill on days when outdoor conditions are not ideal. If you must walk on concrete, make sure your footwear is providing maximum cushioning compensation. Your joints were designed to last a lifetime, but only if you treat them with the respect they deserve. Mistake number 4, walking with stiff, locked, motionless arms hanging at your sides. Now this one surprises almost every patient I mention it to. Most people think walking is purely a leg exercise. You move your legs, your arms just come along for the ride. But that thinking is costing you enormous benefits, and it is actually creating problems you may not even be aware of. Here is the biomechanics of what is happening. Your body was designed to walk with a natural, coordinated arm swing that mirrors your leg movement. When your right leg steps forward, your left arm swings forward. When your left leg steps forward, your right arm swings forward. This cross-body coordination is not accidental. It is how your spine maintains balance, how your core stays engaged, and how your cardiovascular system gets properly activated during movement. When you suppress that arm movement, walking with your arms stiff, crossed in your pockets, or holding onto something, several things go wrong simultaneously. Your lower back loses its natural rotational counterbalance and takes on extra strain. Your posture collapses forward. Your stride shortens. Your core disengages. And crucially, your heart rate and circulation response is significantly reduced. For seniors managing heart health, blood pressure, or circulation issues, that reduced cardiovascular activation means you are getting far less benefit from your walk than you should be. You are burning fewer calories, pumping less blood, and giving your heart a less effective workout. The fix is to allow your arms to swing freely and naturally. Keep your elbows slightly bent at about 90 degrees. Swing forward and back, not across your body. Keep your hands relaxed, not clenched. This simple correction improves your balance, protects your spine, engages your core, and turns your daily walk into a full-body cardiovascular event. Start practicing it today. Mistake number 5, going for a walk immediately after eating a full meal. Now I know this one feels counterintuitive because so many people have heard that a walk after dinner aids digestion. And a gentle, slow, short stroll, 10 to 15 minutes of very light walking, can indeed help with mild digestive discomfort. But that is very different from going out for your regular 30 to 45-minute brisk walk right after a substantial meal. And that distinction is critically important, especially after 60. Here is what is happening inside your body when you eat. Your digestive system activates and immediately begins redirecting blood supply to your stomach and intestines to power the digestion process. This is called postprandial blood flow, and it is significant. Your body is essentially sending a large portion of your total blood volume to your gut to do the work of breaking down and absorbing your food. Now, if you stand up immediately after that meal and start walking briskly, your leg muscles and cardiovascular system suddenly demand that same blood supply. Your heart is now being asked to serve two major systems simultaneously: your digestive system and your active muscles. For a healthy 25-year-old, the heart can manage this relatively well. But for a senior over 60, particularly one managing blood pressure, heart disease, or diabetes, this cardiovascular competition creates serious risk. The consequences can include stomach cramps and nausea from disrupted digestion, dizziness and lightheadedness from blood pressure fluctuations, a condition called postprandial hypotension, where blood pressure drops dangerously after eating, which is actually more common in seniors than most people realize, and in severe cases, irregular heart rhythms triggered by the cardiovascular strain. My recommendation is to wait a minimum of 30 to 45 minutes after a light meal before walking. After a heavy meal, wait at least 60 to 90 minutes. Use that time to sit quietly, have a conversation, read, or simply rest. Let your digestive system do its work first. Then go for your walk. Your heart, your stomach, and your energy levels will all benefit. And we have arrived at mistake number 6, the most dangerous mistake on this entire list, and the one I feel most strongly about as a cardiac surgeon who has seen the consequences firsthand. Mistake number 6, ignoring pain signals and pushing through. Somewhere in our culture, a deeply damaging idea took root. No pain, no gain, push through it, toughen up. Pain is weakness leaving the body. These phrases might have some limited application for competitive young athletes in a controlled training environment. But for seniors over 60 who are walking for health, they are not just unhelpful. They are genuinely dangerous, and I need you to let them go completely. After 60, pain is not an obstacle. Pain is information. It is your body's most urgent communication system telling you that something is wrong and needs your attention. And depending on what kind of pain you are experiencing during or after a walk, that message can range from mildly important to immediately life-threatening. Let me walk you through the pain signals that must never be ignored. Joint pain in the knees, hips, or ankles that gets worse as you walk, not better, is a signal of inflammation or structural damage that pushing through will only worsen. Chest tightness, pressure, or a squeezing sensation during walking is a potential cardiac warning sign that requires you to stop immediately, rest, and seek medical attention if it persists. Shortness of breath that is disproportionate to the effort you are putting in, meaning you are breathing very hard on a gentle, flat walk, can indicate cardiac or pulmonary problems that need evaluation. Calf pain or cramping that occurs consistently at a certain distance of walking and then relieves with rest is a classic symptom of peripheral artery disease, reduced blood flow to the legs, and it must be assessed by a doctor. Dizziness, lightheadedness, or a sudden feeling of weakness during a walk are warning signs of blood pressure fluctuation, dehydration, or cardiovascular stress. None of these signals should be pushed through. None of them should be dismissed as old age. None of them should be something you just learn to live with. Each one of them is your body asking for help. The right response to pain during walking is to slow down immediately. If the pain does not resolve with reduced pace, stop walking entirely. Rest. Hydrate. If the pain involves your chest, your breathing, or your heart, or if it does not go away within a few minutes of rest, call for help or go to the emergency room. Do not drive yourself. Do not wait until tomorrow. Go now. I tell my patients this every single day. The seniors who thrive into their 70s, 80s, and 90s are not the ones who ignored their pain. They are the ones who listened to their bodies, responded wisely, and lived to walk another day. So there you have it. 6 walking mistakes that could be silently destroying your health after 60, and exactly what to do about each one. Let me give you a quick recap so you can remember all 6. Mistake number 1, skipping your warm-up before you walk. Give yourself 5 to 7 minutes of gentle movement every single time. Mistake number 2, wearing the wrong shoes. Invest in proper walking footwear with cushioning, arch support, and a stable heel. Mistake number 3, walking on hard concrete every day. Mix in softer surfaces like grass, tracks, or a treadmill whenever you can. Mistake number 4, not using your arms. Let them swing naturally and turn your walk into a full body exercise. Mistake number 5, walking immediately after a heavy meal. Give your body at least 30 to 60 minutes to begin digestion first. And mistake number 6, the most important one, never ignore pain signals. Your body is speaking to you. Please listen. Now I have a question for you. Which of these 6 mistakes have you been making without realizing it? Drop your answer in the comments below. I read every single one, and your answer might help someone else watching this video right now. If this video was valuable to you today, please do 3 things for me. Hit the like button right now. It helps this information reach more seniors who need it. Subscribe to this channel so you never miss a video. And share this with one person you love who is over 60. It could genuinely change their health. It could even save their life. I am Dr. Rose, and I will see you in the next video, where we are going to talk about something even more important for your heart after 60. You do not want to miss it.